TIPS stands for Transjugular Intrahepatic Portosystemic Shunt. TIPS procedure is a minimally invasive procedure that we perform where we place a stent in the liver. By placing a stent in the blood vessel in the liver, we're able to bypass the flow in the liver. What happens in people with cirrhosis, there's a buildup of blood pressure in the portal vein because of the scarring of the liver. What we do is we thread a stent into the portal vein and extend it into another vein called the hepatic vein and allow the liver to divert the flow into another vein through the TIPS shunt. By doing this, we're able to control the pressure in the liver and therefore treat some of the symptoms related to cirrhosis and portal hypertension. Most centers don't do TIPS because of the complexity, but at Piedmont Hospital we do it fairly routinely. We probably do at least 1 to 2 TIPS a week. TIPS is a fairly invasive procedure in the sense that we use anesthesia to help us during the procedure. Patients usually are pretty sick because they have advanced cirrhosis. But at the same time, we have a lot of expertise in doing this procedure and very advanced imaging to help guide us. Because of the combination of those two, we're able to do these procedures fairly routinely now.
In TIPS, the complications can be stratified into those that are more immediate and those that are more intermediate or long-term. The first possible risk of the procedure is bleeding. So we routinely will check to make sure there's no internal bleeding after the procedure. In the intermediate period, over a period of 2 to 3 weeks, there is a possibility that patients may develop something called hepatic encephalopathy. And that is where blood flow has been altered to the liver to the extent that the liver doesn't do the cleansing that it normally does. And this is typically seen 2 to 3 weeks after a TIPS is created. And that's usually heralded by things like becoming more sleepy all the time, forgetful, slow mental acuity, where you would normally be able to answer very quickly when someone asks you a question or respond in a conversation in a fast and a fluent manner, and that slows down. Family members are more likely to see this than the patient themselves, and they should definitely contact us if they notice this. Usually this can be dealt with medications. Occasionally we have to do an additional procedure to control this encephalopathy.